Luca BUCCOLLERO, доктор философии факультета маркетинга Университета Bocconi в Милане.
So, good afternoon. My name is Luca. I am aware that we are running a little bit late, so I asked Elena, who is in charge of the next presentation, to join me on the floor, and let's say we will share and we will try to merge the two presentations, which actually are connected, and both are related with a specific industry, which is healthcare, and also adopt the same framework, which is a managerial framework. So our point is that managerial skills are needed to the Chief Information Officer, and let's say must enrich the role of the Chief Information Officer, who is supposed to be the master of technologies in his company, but he should also have a role in defining the strategies of the company, of the business. And I mean, our suggestion as professors of marketing is to always take into account the needs and the value of your external customers. So marketing is the science of being obsessed by the customer, and for Chief Information Officer this is an important challenge. So how to use our technologies in the best way in order to create value for our customer. So in healthcare, the customer is the patient, and our presentations are, let's say, try to understand the role of technologies in shaping the experience of our customer, of our patient. We use the word patient journey to describe, let's say, an emotional roller coaster which is experienced by the patient during his relationship with hospitals, medical doctors, and whatever. And it's something not so predictable, not linear. And our point is that technology in the healthcare industry must be wisely combined with, let's say, the needs of the patient during the journey. And if we take a marketing perspective, if we are curious to understand the needs of our customer, well, as for the patient, we are aware that starting from, let's say, 20 years ago, the needs and the values of the patients have changed in a very relevant way. Almost 10 years ago, we published an article on the new needs of patients in the digital world, in the digital context, and we, let's say, concluded that patient is now more empowered, so he wants to have control, he wants to have information, and he is aware of the potential of digital technologies during his experience. We are also aware that COVID-19 acted as probably the most important digital health accelerator. So the role of digital technologies in healthcare was, let's say, enriched by the unlucky event of the pandemic, and our research tried to address this point. So to what extent did COVID-19 change the expectations of patients, and to what extent digital technologies could provide some answers to the new needs. Some research also shows that some changes happened in terms of satisfaction and trust of patients after the COVID. So COVID-19 on one side emphasized the role of technologies, of digital technologies. On the other side also had some impacts on the overall satisfaction and trust of patients. Well, our research, the research we are trying to present to you today as fast as possible, was based actually on a survey and had two main objectives. The first objective was to profile the new expectation of patients during the pandemic and soon after the pandemic, at the end of the pandemic, and also to, let's say, create a model, a research model, in order to understand how different variables connected with digital technologies could make the difference in terms of trust, satisfaction, and the overall, let's say, quality of the experience. So, as I told you, the research was based on a survey. Almost, let's say, 900 people in Italy responded, answered our questions, and let's say we were able to collect some insights and therefore to profile our respondents and our patients. And so the 4 pillars of our insights are shown on this slide. I would say we finally understood that patient is now more curious, became more impatient, became more demanding, and is also more aware of the overall conditions. Well, as for curiosity, it's probably linked with anxiety during the patient journey. There is a need to be in charge, to keep the control of the situation, and probably we also deal with over-informed patients. So technology also plays this role of providing, let's say, probably an excess of information to the patient. And it's very interesting to understand what happens in Italy, where a national health service is operational. I would say that the curious patient cannot find the answers he's looking for on the public healthcare websites. So private sector is now able to support patient in his search for information, but the public organizations, hospitals, are still, let's say, quite far from that kind of, let's say, needs. We also tried to understand some details on the curiosity of our patients, and at the first, let's say, in the ranking, in the top position of the ranking, we find curiosity and, let's say, a need of transparency about the waiting times, the waiting list, which is perceived as one of the major issues in our system, and probably also the need to be supported in understanding the meaning of clinical reports. So what's happening to me, what about my condition, and so I want to have an immediate answer to that kind of situation. The second insight was impatient. Our customers are now more impatient than in the past. And by impatient, we mean that patients now want an immediate opportunity to be connected with the health provider, especially the medical doctor. So, let's say, actually, top priority is to have access to technologies which immediately provide a connection with the provider, with the medical doctor. And here, I mean, the first requirement is at least the opportunity to have a phone number or, let's say, instant messaging and WhatsApp and whatever. So what is really perceived as important is, let's say, the immediacy of this contact in the overall process of care. Social networks are not so relevant, and also the availability of video call is not perceived as the key variable. What is important is to be in touch, and to be in touch as soon as I perceive the need. We also tried to describe what happened to digital services during the pandemic and after the pandemic, and so why our patient became so demanding, which is the third attribute we pointed out. And you see, the situation is very different. There is a huge difference between administrative services and clinical applications. Because on the administrative side, well, we perceive that the adoption of some digital services is, let's say, well advanced in the Italian context. In the top ranking, you find the download of clinical reports from the web. It was already quite mature before the pandemics. The orange part of the bar describes the percentage of new adoptions because of the pandemics. And you see there is a huge maturity of that service. Probably one of the biggest orange bars on the graph is related with e-prescription. So paperless prescription process was probably the application which, because of the pandemics, was more, let's say, advanced and more adopted by patients in Italy. But always on the administrative side, we can also see that e-prescription, so paperless prescription, is considered probably the most valuable digital application for our patients. So I would say on the administrative side, a huge maturity of patients and also of the services which are provided. The situation is very different on the clinical side. It means not only managing data and administrative information, but take care of clinical conditions. What we are going to call, Elena is going to call telemedicine in a few minutes. Because as for clinical digital application, as far as clinical digital applications are concerned, we find really a low level of maturity. And you see that, let's say, also for teleconsultation, so the use of video call to manage a visit or something like that, more than 60% of patients never experienced that specific service. And I would say that service is not provided on a regular basis in the system. Also, home teleassistant is still very far from maturity. And obviously, also the perception of value from the patient perspective for this clinical application in Italy is still quite limited, because actually they never or almost never or very seldom experience that kind of application. Only, let's say, emergency assistant, thanks to technology, is perceived as something relevant. There is also a good level of awareness in our patients, and this awareness is related on one side with, let's say, the clinical risk associated with pandemics, and on the other side, also with the risks associated with the use of digital technology. So there is awareness of privacy issues, there are some privacy concerns about digital technologies, but I would say that overall, that's quite reasonable, so there is no excess, an excess of fear, of anxiety about those issues. So I would say quite a mature patient. Finally, that's very important in our perspective, I would say that overall our patient perceives some value in digital services which are provided. For instance, access becomes easier thanks to digital technologies, less tiring. Probably there is an improvement in lifestyle, in, let's say, maintaining a good health. And that's important. At the end of the day, digital technology provide the perception of more personal empowerment for the patient. Then I would leave the floor to Elena, with my colleague at Bocconi University and also at Ca' Foscari University in Venice. She's professor of management and marketing, and I ask her to show you the research model and some, let's say, quantitative evidence which we derived from the project. Then I will be back to you in a few minutes for the second part of the presentation.
Okay, thank you very much. Don't worry, I won't be too statistical, but what I want to show you is that in our research we also developed a model in order to test if actually this perception of risk linked to COVID-19 has actually an impact on the link between people and digital services in healthcare. What we have seen is actually that there's a positive impact in the risk perception. So the more you perceive the risk in COVID-19, the more people, patients, perceive usefulness in the digital services that healthcare offers, and also in the activation of those healthcare services. In fact, we have seen a big rise in the activation of services. It means that people started to use the digital services or IT devices in healthcare which before had never used. We also wanted to test if actually there was an effect in linking this variable, so the usefulness perceived in digital services or this level of activation in some main drivers that are linked to the business, so the managerial perspective. So if actually patients' trust in the healthcare system rised, if the level of loyalty rised, and also the level of empowerment. So going back to what was the way we profiled patients, and actually we have seen that the perceived usefulness in the digital services has a positive impact in everything, so in the level of trust, in the level of loyalty, and also in the perceived empowerment that people have. The idea of activating healthcare services linked to digital care actually has an impact on loyalty and empowerment. It's reasonable that it hasn't registered an impact on trust, since just activating them doesn't impact so much in trusting the healthcare system. But since you link to a digital technology, you become more loyalty. Then from a statistical point of view, we also tested mediation effects. This just means that actually this perception of COVID risk has an impact in rising the patient's trust, loyalty, and empowerment in the healthcare system. And this effect is actually reinforced. It becomes higher by perceiving the usefulness of digital service in healthcare and the idea of activating them. So in order to put together, this is just a description of all the hypotheses, but as I told you, I don't want to tell you all the statistical method that we used. But I would like to put together what Luca has presented and the results of both parts of the research, so the profiling of patients and the variable test. And in fact, we can say that actually our patient, we said, so our people are inpatients. So they want information on one side, and actually the search for information is now highly web-based. So the web is as the privileged source of information and help people in obtaining immediate answers. And the other impatient thing is to have an immediate and direct informal channel of communication with medical professionals. So here we can actually find the inpatient dimension of our clients in healthcare. About the digital component, as Luca said, it's highly developed in the managerial field, so in the administrative aspects of the patient journey. So, and the link from the administrative point of view between the patient experience and the healthcare system. Not so much in its clinical dimension. And we said people are now demanding, and they demand for services, digital services optimization. So people start to understand that there can be also an improvement in the clinical side. And then a specific focus on telemedicine, since in Italy is still struggling to take off because people don't perceive it much yet. But this is because we believe it's because the level is not developed yet, so it's really hard for people, for clients, for patients to understand how big the usefulness of telemedicine could be. So how big it's the usefulness to be empowered could be if a telemedicine project would be developed in a proper way. As Luca said, we are merging the presentation since the schedule and the running out of time. So I would like to start immediately with our second presentation, if it's possible, because it's highly linked to what we have just said. We would like to give our managerial perspective. So Luca named, thank you very much, Luca named the patient journey. And in fact, from our managerial and marketing perspective, we have to think that digital health systems exist and can exist and improve very easily. But what we have to do is to add the managerial dimension. On one side we have digital health, so the devices, IT devices. On the other side we have the system. What we have to be able to do today in order to succeed is to add like the organizational dimension, the strategic managerial dimension. We have to look at the digital health system as a process where we have to include legal dimensions, the skills, digital skills, and also the customer, so the customer orientation. And this is what we are trying to do through our research activity, and also in our consultancy activity in our university job. So the idea would be to be really good in technologies, but also to think that if we invest like $1 for the device, we have to invest at least $3 from the managerial perspective in order to create the organizational process and model. This is the translation of the comment a patient did in Italy, so it was in Italian, that's why it's a translation, in 1994, sorry. So it's long ago. But what I want to tell you is that the situation hasn't changed yet. very much. So the interesting thing is that this is looking at the healthcare system through patients' eyes. So a patient says that everything is handwritten. The doctors have to understand and interpret what, like depict what the previous doctor wrote. And so it's a hard job which is not supported by anything. And every time patients are involved in this process by having to add their own personal information. This was in 1994, as I said, but today there's not much difference, even if technologies are there to help the system and patients. So our idea is to bring back the patient journey. This slide just sums up what we have just seen. So the idea of looking at patient's perspective too, in order to consider the main technologies they look at, like mobile is fundamental, the use of images and videos too, and this idea of including everything into this patient journey. So the thing is that we have digital solutions, and you know this more than me. Like, we have really everything. The problem is how to put this into a system that can really work for the healthcare system itself and for patients too. So the two things move together. And the answer should be that in order to make everything work, we have to look at the patient journey. The patient journey, which, as Luca said, could be considered a roller coaster, and this is important, so it's an up and down of feelings and behaviors which can't be predicted because it's the way that the patient behaves and its caregivers, has actually some phases. So we know they go from the first phase of awareness, like there's something wrong, I have to be in contact with a healthcare system and understand what's happening, I need to ask for help, then I get the care, the real treatment. This could imply some implies behaviors by patients that could be even lifelong change in behaviors. So the system has to help patients, so the empowerment, to understand what they have to do, and then this idea of ongoing and proactive care process. So if this is the patient journey, so we follow the person from when he gets in contact with a healthcare system till his whole life, it means that we should look at technologies, digital solutions, in order to support each phase of this journey. In the slides, you can see some examples. So adding the right solution into the right moment of this journey, of this process. So this would mean putting together the digital solution and the managerial perspective. In some cases, this is called also like the perfect storm, because we know that it's really challenging. Like, it's easy for me to come here and just say this. It's harder to turn it into practice, and a working practice or a succeeding practice, because it's really a change in the perspective, in the strategy, in the process. And it means on one side to look at patients, which were described before by Luca. So the idea of someone that is where needs and expectations are rising really a lot and really fast. And on the other side, the healthcare system, specifically in our country at the moment, lacks of financial resources. So putting together this makes it like the perfect storm. So there's actually the challenging gap that we should be able to. Okay, we were at the perfect storm, which actually happened, or almost happened. So going, okay, so there are three main, there's a slide that it's continuously skipping, but never mind. So just to see which could be the three blocks in order to perfectly manage this storm is the idea of proximity to patients. So we have this idea of patient journey that we should keep in our mind. Of course, the hospital in our context remains a place of reference, but we know there are other solutions that can help the healthcare system to be in contact with people, with caregivers, with patients in any step of the journey. This could mean also to move from the hospital to an ubiquity of service, the idea of offering home care. In fact, we have today a huge variety offering of devices, of solutions, of IT services that can support people while they are at home. And the interesting thing is that this already covers people from their whole life. And now we would like to show you a few examples of pilot projects that are linked to telemedicine that can actually support people in this idea of following them through the patient journey, allowing them to feel more empowered and also more secure and have more loyalty and trust in the healthcare system. Those examples come from the activity we're doing in research and also in consultancy with some companies that are actually trying to introduce those systems in Italy, for example. This should be a short video. I hope the volume works. Thanks.
So this is the first example of digital application in one very selected moment or in a very specific life events of a person. So maternity care, as you probably know, the pilot project was developed at Mayo Clinic in the States, and during the COVID, we did some attempts to use these devices, especially to reduce the burden and the danger in the access to hospital. And let's say we got some evidence which demonstrate a significant impact on outcomes in terms of health conditions for patients. For instance, early detection of pregnancy complications, so there is a huge value in clinical terms, optimization of high-risk pregnancy, and let's say also a reduction of costs, which is quite important in the perfect storm, which was mentioned by Elena, because of, let's say, the new processes which have been implemented. Then we can say that the emergency use of this technology during the COVID-19 resulted in a great success. But unfortunately, we were not able as national service to change these pilot projects into, let's say, a fully operational process. So it's still very slow, the adoption of these solutions after the pandemic. So I would say that there is no clear understanding of the benefits on one side, but probably, most important, we were not able to actually create the convergence between technology and organizational and business models, which were shown in the theoretical framework in the beginning. Let's see another example of technologies. This was used in Israel and developed in Israel, and also we tried to adopt it in Italy and in the Italian regions of Switzerland. The device is called TytoCare.
When your family is sick, you'll want all the information you can get, and as quickly as you can get it. That's why we created TytoHome, an innovative device that connects you with a clinician anytime, anywhere, even from home. To connect to the service, you'll need the Tyto app on your smartphone for a real-time video conference and the Tyto device to conduct the remote exam. The device has an easy-to-use touchscreen that guides you through the examination process. You can conduct exams on the heart, lungs, ears, throat, skin, and body temperature. Let's see how it works. Emily has a cough, earache, and a fever. Her mother, Linda, requests a live examination with a clinician. The clinician can see and speak with Linda and Emily to guide them through the specific exams he'd like to perform. In this case, he examines her ears, throat, and lungs. Results appear instantly on the clinician's screen so that he can listen to and see the exam results in real time. Having diagnosed an ear infection, the clinician digitally submits Emily's prescription to the pharmacy for pickup. He can also send a referral for a specialist, as well as keep the test results in Emily's records for future reference. This remote exam saves Emily from a late-night visit to the ER and gives her mother peace of mind that she received the right diagnosis and treatment, all from the comfort of home. TytoCare, your on-demand medical exam.
So, as far as we know, this is probably the only certified device which allows a televisit. I mean, so the distance monitoring of health data. I would say the use for children is especially recommended. And if you have small children, you are fully aware of the problems which arise, especially during the weekend, when it's really difficult to find a doctor in order to manage a fever or, let's say, a cold or something like that. So that could be the priority for the implementation of this device. But I would say it can be used for also for adults, and it allows the certified collection of clinical data. So this video, let's say, shows the use for
when your family
for
is
children,
sick, you want to get answers quickly, and getting to the doctor isn't always easy. Introducing Tyto Home by TytoCare, an FDA-cleared, award-winning remote medical exam kit that enables you to get a medical exam by a medical professional from the comfort of your home. With Tyto, clinicians can remotely diagnose and treat many of the most common conditions, such as ear infections, colds, flu and viruses, sore throat, congestion, and rashes. The Tyto device comes with an app and special adapters for examining the heart, lungs, throat, ears, abdomen, skin, and temperature. Let's see how it works.
Okay, we can skip it. It was just to show, let's say, a specific use with children, which could be, let's say, one of the priorities. And again, we tried to measure something about the use of this device, and we did it in Switzerland, where a significant pilot case study was developed by an insurance system, and the final result, which has been published, also shows an important, relevant reduction of care expenditure for the provider, so from the system perspective, and also a reduction of out-of-pocket patient expenditure. And I would also add, as a parent of a young child, there is also huge evidence of value for parents in terms of reduction of anxiety and immediacy. We started by saying that our patient is now impatient, so wants an answer immediately. That's why we very often go to the emergency department, because we want an immediate answer. And these kind of devices can actually support that kind of needs. And finally, we move to, let's say, the final stage of people's life, let's say elderly care or senior home care. And this is an experience of the adoptions of sensor at patient's home. So it's a use of technologies directly at home. As Elena was saying, now the new point of care is patient's home instead of the hospital. I would say hospital is the traditional approach, but patient home as care place is probably the new priority. And here you can see, you can have some evidence of the value you can create.
This is Vayar Care, the world's most advanced touchless technology. Radio frequency sensors monitor seniors 24/7 without cameras, buttons, cords, or wearables, maintaining privacy and dignity at all times. Vayar Care collects rich point cloud data on presence and movement. Instant fall detection enables caregivers to provide rapid response, eliminating long lies and identifying even minor, hidden falls that often lead to more serious incidents. If there's a fall, Vayar Care gets help. The system tracks in-room activity in real time, such as when a resident is in or out of bed, indicating mobility, time at rest, and other patterns across any defined period. It counts bathroom visits. High frequency or changes in schedule could indicate an issue such as a UTI that requires medical attention. Because VIAR Care works in all conditions, including pitch darkness and dense steam, caregivers can confirm room occupancy around the clock and carry out efficient evacuations if required. And it alerts on imminent bed exits for at-risk residents, enabling intervention and true fall prevention. VIAR Care operates over 2.4 GHz Wi-Fi, supporting wall or ceiling installation and dry contact integration. VIAR Care's data provides constant visibility into each resident's activity and well-being, supporting personalized care plans, improving occupancy, boosting staff utilization, and enhancing your brand's value. VIAR Care. Protect seniors, respect their privacy.
Yeah, there is also an issue of privacy protection. As you could see, the image was, let's say, pixeled, only pixel, no clear view of the patient because of, let's say, dignity and privacy of him. But this is a very significant, let's say, example. And we also try to estimate the value and the contribution of this kind of solution. Well, on one side, to the value and the quality of life of senior citizens who are now allowed to stay at home as far as possible before, let's say, going to a nursing home, so they can stay in their familiar environment at their home as long as possible. So there is a clear value in terms of, let's say, quality of life of the person, of elderly persons. On the other side, we can also show a significant reduction of costs for the system. For instance, a reduction in long-term care, which is probably the most important reduction, a significant the reduction in the access to emergency department, which you know is the most expensive and critical area for health services, and actually it results in a significant increased degree of efficiency for the system. So just a few final comments. We started by the analysis of the value drivers of our patients today. It means always take into account the needs and the value which our customer is looking for. Always start from the customer. When you implement a digital service for a government, in this case, a digital service for the health system, never forget what your customer wants. In our experience, that's probably the most frequent mistake we do, especially if we fall in love with technology and we forget the needs and, let's say, the objectives of our implementation. And then the second, let's say, pillar of our presentation, always try to build organizational models and also business models which are consistent with the technologies you are adopting. So the implementation of the three examples we have studied and we have presented today should require a new approach and a new revision of the organizational models of the system, and also the creation of strong business models which can be supported and which can be put in place together with the technology. So technology itself is not the solution if it is not supported by these, let's say, organizational and strategic financial changes. And finally, we also have a problem of skills, of digital skills. In this case, we still have room for improvement for digital skills of medical doctors on one side and patient on the other side. Even if our first analysis show evidence that patient is quite open to the adoption of these solutions, and I would say there is, on average, a good availability of the required infrastructure. In some areas in Italy, we still have problems in the availability of ultra broadband, which is actually the key solution, the key condition for implementing this project. But overall, I think that's not the most critical part of the process. Organization and, let's say, sensitivity to customer attention are probably, in our opinion, the priorities for all of us who take care of the implementation of technology. So thank you very much for your attention, and thank you, Elena, for your part of the presentation. That's all. Thank you.